Saj, how you doing today?
I'm alright, thanks. How are you?
I'm doing okay. Thanks for asking. I understand you've been having some symptoms that have been bothersome to you.
Yeah.
Can you tell me about those?
Yeah. For about the last 6 months or so, I have this position at work where I have to make a weekly presentation to other managers, about 10 people, and every time I have to do this, I lose it.
You lose it every time you have to make a presentation?
Yeah.
Tell me what is involved with losing it.
I'm usually one of the last people to go,
Mhm.
and as I just keep feeling more and more and more and more nervous. It starts where I feel like butterflies in my stomach, and that just becomes more intense. I start to just sweat all over. I feel like my face is turning red. My palms get really, really sweaty, and I constantly wipe it on my pants, and my heart, it just feels like it's going to just beat right out of my chest, and I can't.
Very distressing. So tell me about the nature of this meeting that's leading to this anxiety. So you said it was you had to make a presentation.
Mm-hmm.
Tell me about the structure of it.
So there's about 10 people, the executive director, and then the managers of different programs, and we all have to do just kind of like a weekly update report.
Mm-hmm.
So none of it's very detailed. Just maybe a few minutes each person to go around and just update everybody else on what's going on in all the different programs, and we all take turns.
All right. How long do you have to speak?
It's usually just a few minutes, maybe 5, at most 10, unless there's something, major going on in my program.
All right. And when in the course of, like, with this meeting occurring, when do you start to feel nervous?
Oh, the day before.
The day before?
Yeah.
All right.
Yeah.
All right. So the day before the meeting, you start to have similar symptoms, different symptoms? What are you feeling?
Yeah, I start to feel nervous. Usually the day before is when I'm pulling together my notes. I make like a few bullet points on stuff that I want to present, that I think is relevant, and so the day before when I'm preparing that, I start to feel nervous, and then it usually lasts through the rest of the day into the evening. I usually don't sleep well that night, and then by the time I get into work, I'm, that's usually when I'm, feeling, really nervous. By the time I get into the meeting, I'm pretty much panicking.
All right, you're panicking as the meeting's starting.
Yeah.
All right. So at the meeting, everybody takes a turn and does this brief presentation.
Mm-hmm.
And tell me what's happening with your feelings as they're moving around. It's like you said, a table, or
Yeah.
As they're moving around the table and coming closer to you.
I'm just becoming more and more terrified. I feel like I'm being just drenched in sweat. I'm breathing faster. I feel like everybody notices. I feel like everybody can hear me breathe. I feel like everybody can hear my heart beating. That it's just so loud that it's like any minute everybody's gonna look at me and say, "What is wrong with you?"
They're gonna notice you.
Yeah.
Yeah.
And there've been times, especially recently, really, it's like I said. I mean, this has been going on for at least 6 months, but especially recently, I feel like I've had to like run out of the room. I couldn't take it.
Have you run out of the room?
Yes, I have.
Yeah.
I've ran out and I couldn't go back in. I tried, and my hand hit the doorknob to go back in the room, and I walked out. Couldn't do it.
There's too much anxiety.
Yeah, I felt okay, in the hallway, and then when I tried to go back in the room, everything just right back up again.
Yeah. So you would push that door open. They would all be looking at you.
Yeah.
They would wonder why you left.
Yeah.
Right. So you just wrote out the meeting somewhere else. And did anybody notice after?
You know, after a few weeks in a row of running out, yeah. You know, my boss was like, you know, I realized you didn't make your presentation, and you know, I made up an excuse, like I got a phone call, or I didn't feel good, or you know, I stumbled through some excuse, but I feel bad because, I mean, this is my job, and I want to do my job, and I mean, I've lived with this, I feel like, forever, you know, because I had a terrible time making presentations in high school, I had a terrible time making presentations in college, and here we are again, and I'm trying to be a professional and have a career and make a life, and I can't, because I can't perform my job. I want to do my job. I like my job.
This is frustrating for you.
Yeah.
Have there been times where you've fled the room, and then since then you haven't?
There was one time, actually the very first time I ran out, and I didn't go back and nobody noticed, and then the second time, that following week, I started to feel that way again, and then two of my coworkers, two of the other managers, actually started to get into a fight. One of them wanted more money for their program for something or other, and the controller was like, no, we have no money, you can't have it, it's a nonprofit, so there's no money. And it was like getting really intense, and I don't know what it was, I was fine.
Something about that intense interaction changed how you were feeling, distracted you, something like that?
Yeah, I guess it just, I don't know, it just didn't, I felt fine, I felt normal.
Alright, so from that meeting on, like, till now, have you been able to stay in for any other meetings?
No.
Okay. So you've had to leave because of the intensity of the symptoms?
Yeah, there have been a couple times where actually I've purposely gone in late. I said I've had car trouble and I haven't, and I've just gone in late. Or I've actually just called in sick for the day. There was twice I sent somebody else in my place saying that, you know, I was sick. But I mean, it gets noticed.
Yeah, and you're experiencing symptoms when you avoid that interaction in the room too, right? Because you don't feel good about letting them down, or... No,
I want to do my job. I really like my job. I really do. And I like where I work, and I like the people. But the thought of making these presentations every week just terrifies me. And I don't want my boss to regret putting me in this position. I don't want to disappoint him. I mean, I know he took a big chance, you know, putting me in this position. You know, I don't have a lot of experience doing this, and there were, you know, potentially there could have been other people that were better qualified, but, you know, he chose me. And I don't want to let him down. And I feel like I am every week with this meeting.
All right, so with this meeting, really, you're in a situation where if you go and attend the meeting, you're going to end up leaving it because of the anxiety. If you don't attend it, you have these concerns about the performance in your job. So you're kind of stuck, right?
Yeah.
Any other symptoms that you think may or may not be related to this intense anxiety?
Like I said, I mean, I'm not sleeping the night before the meetings. I have started to drink a little bit to try and take the edge off. A friend of mine had said before that it's something that she's done to help when she's nervous, and so I tried a shot or two before going into my meeting, and
does that have any effect on?
Probably not a good effect. I mean, I was able to sit through the meeting, but everybody kept asking if I was okay. So
They're picking up on the alcohol.
Yeah, I really feel like they were, and of course I didn't want anybody to get close to me because
They could smell it.
Yeah, I was too scared to do that again.
All right. Any sadness or anything like that?
I'm miserable. Every time I think about, you know, how much I must be disappointing my boss, I just feel terrible.
You feel really down.
Yeah.
Yeah. Sasha, I know it's been tough going through all this, and these symptoms have been tough for you. We'll get you scheduled in here to get treated in a couple days.
Sure.
We'll get you in a couple days, and you can start working with a counselor to address these symptoms.
Okay.
I appreciate you spending this time with me. It was helpful to get a better understanding of what you're going through.
Thank you.
Thanks.